There's always a way to make life better. This is our belief. The goal that we have in Philips is to touch 3 billion people a year by 2025. This is a global goal. Today, where we are is at about 2.1 billion people worldwide. But you must ask what we're doing in the Indian subcontinent. And we are today touching almost 216 million, or 21.6 crore people in India. And we have a plan to at least double that in the next 3 or 4 years. The innovation that we indulge in for our new products in Philips is not technology for technology's sake. I don't think we're a company that is going to prove its technical prowess by saying, hey, when is the next 7 Tesla or even higher kind of a magnet going to hit the market? I don't think that's our ethos, that's our philosophy. I think we put the patient in the center and we see how we can make the patient more comfortable. How can we make the doctors and the users, how can we make them more comfortable? How can we get things first time right? How can we get the total cost of ownership further reduced for people like yourselves in the room? How can we make sure that we can touch more and more people today? And that's the ethos of how we design our products. We make use of big data, artificial intelligence, which is what you will always hear technology connected with today. But we actually make a whole lot of use of all these buzzwords and more to ensure that the patient, the user, and the businessman behind healthcare ventures gets a good deal. We are a company that believes in constant improvement. We subscribe to the lean philosophy that the Japanese introduced in the car industry. We believe in the Kaizen way, which is constant improvement. Not only do we do that internally in our own company, but we've been able to help clients as well. Now the example, I'm not going to go through all the words on the slide, but essentially what it talks about is one of the examples where an old hospital, a very renowned hospital in the south of India, the infrastructure that they had was to maybe accept, say, 200 people through its doors every day. Okay? There's 200 people who would come in through the doors, need to be routed to OPDs, need to be routed to different specialists, to the operation theaters. And that number actually swelled almost 10 times in the last 5 years. Clearly, that infrastructure is inadequate. But here's where we could come in, sit with all the people who are in touch with patients, who were in touch with all the people walking through those doors. We were able to look at value stream mapping, all the different bottlenecks in there, and we were able to spin a process for these patients that was able to get them through in record time. Today, the satisfaction level of these same patients, and 2,000 of these, is at an all-time high, and this hospital is absolutely satisfied. Now, we can replicate this more and more across hospitals in this country.